Okay, so we'll be focusing at what? Yeah, renal impairment. But this is us actually looking at the laboratory, how the laboratory can help you to be able to diagnose a renal impairment. Do you understand? So we'll be looking at the biochemical parameters that are involved. Okay, if you want to use the laboratory to confirm that, okay, uh, there's a renal problem, there's a renal disease. Okay, all right, so we'll be looking at the applications of the laboratory. So the full question I was asking an exam was what? List 6 biochemical parameters useful in laboratory assessment of renal impairment. Okay, and also emphasize on the importance and significance of each test. So one thing is that doing this, you basically what? There's significance and importance is like, okay, you list the test, you add few notes on it, that's all. Okay, so let's talk on the first one. We have 6 to talk about. Let's talk on the first one. For renal impairment, you might want to do a creatinine test. Okay, so now in creatinine test, increased serum creatinine levels reflects what? Glomerular dysfunction, because this creatinine is a waste product that should be excreted. All right, so if you find what? Creatinine in excess level in the serum, that means what? Creatinine is not being excreted. All right, so there's a glomerular dysfunction. All right, decreased creatinine levels, however, indicates what? Reduced muscle bulk, and this could be due to what? Starvation, wasting disease, or steroid therapy. Okay, so this is to tell you that creatinine is a waste product that is made from muscle metabolism. Okay, so physiological variations include creatinine is normally decreased in pregnancy. It is elevated in what? High meat intake. Okay, and it could be elevated in what? Strenuous activity. Let me say you do an exercise, you go around, you do an exercise, do some early morning jogging, your creatinine levels will be elevated. Okay, and moving to the next test, you might want to do a urea test to assess for renal impairment. Okay, now let's talk about the cases of elevation and cases of what? Decrease. So elevation, now you could have pre-renal causes. Whenever I say pre-renal, these are causes that are before the glomerulus. Basically, things that happen before the kidney comes in. Do you understand? Pre-renal, all right? Pre-renal could be due to you might have elevated urea levels because you actually took too much protein in diet. That is happening before the kidney. That's a pre-renal cause. Then also decrease in renal perfusion. That means there's reduce in what? Blood that is coming to the kidneys. That's happening before the kidneys. Do you understand? That's a pre-renal cause. Then talking about the renal causes now, this is what has to do with the kidney. Okay, and renal causes, there is what? Decrease glomerular filtration rate. Okay, decrease glomerular filtration rate. That's a renal cause. Then post-renal causes. This post-renal causes is what is happening after the kidney. All right. So you are basically talking about, yay, what is happening inside the kidney too. Okay. But mostly I'm talking about the ureter and the urethra. Okay. So the post-renal causes, now you might have what? A benign prostatic hypertrophy. That's BPH. You might also have what? The kidney stones. I might also have what? An obstruction. Okay, so elevation could be pre-renal, renal, and post-renal. Okay, then decrease. Now talking about decrease, severe liver disease could decrease it. Low protein in diet could decrease it, and water retention could decrease what? Urea levels. Okay, severe liver disease, low protein in diet, water retention. Okay, then specific gravity now. Talking about specific gravity, they're basically just talking about pressure. Okay, so if there's a reduction in water levels in the body, you have accumulation of solute, so there'll be more pressure. All right, so specific gravity will be increasing dehydration. All right, to be decreasing what? renal, to be decreasing what? Loss of renal tubular concentration ability. That means all those electrolytes are not being absorbed back into the body, so pressure will decrease. Okay. Also to be decreasing what? Diabetes insipidus. Okay. Then I'm talking about phosphate levels. Talking about urine phosphate, it will be decreasing what? Tubular dysfunction, leading to alkalinity. All right, tubular dysfunction, that means what? Let's look critically at this. Tubular dysfunction. Okay, that means potassium is being absorbed too much into the body, leading to alkalinity, and blood potassium can be increased in tubular dysfunction, leading to alkalinity. Okay, let's look critically at this. Decrease in tubular dysfunction. Urine one. Okay, the one that will be excreted in urine will be decreased if your tubules are not functioning well and potassium is going back into the blood. Do you understand? Then the blood will ultimately be increased. Do you understand? In tubular dysfunction, right? You might also want to do a test for what? Serum albumin, okay, which may be increase in protein loss. Serum albumin, that's the levels of albumin in serum albumin, that's levels of albumin in the body. Okay, serum albumin might be decreased in what? Glomerular dysfunction. Decreased serum albumin will be decreased. All right, this is decrease. All right, this is decrease in protein loss. Okay, and this is what? Proteinuria, not proteinemia. Okay, proteinuria. All right, proteinuria. Okay, so this is serum albumin will be decreasing protein loss. Okay, and that's when you're having conditions like proteinuria. That's when you're passing out protein in urine. Okay, so let's make sense out of that. There is be decrease in what? Glomerular dysfunction, of course. The glomerulus is not competent enough again, so anything is passing through it. Okay, then serum bicarbonate now. Serum bicarbonate is elevated in metabolic alkalosis and is decreasing what? Metabolic acidosis. All right, so these are the possible tests you might want to do, biochemical parameters in laboratory assessment of renal impairment. So that's A and bye for now.